My name's Mike Hanrahan. I'm the Telecare and Telehealth Manager at Wirral Council. Big part of my job at the moment is the analogue to digital switchover. Andi is different because they are truly agnostic. We are not reliant on the same company making all their own peripherals and all their own devices, and that opens up a huge opportunity. Sensors and devices are coming along all of the time from all different types of sources, and we want to be able to use the best of what's out there so that we can provide that flexibility really and that personalisation to people in their own homes. I think here in Wirral we made a commitment that we want to use the latest technology, and when we first met with 2IC Care and they told us about their product Andi, we were really keen to deploy it in the community.
We are currently looking at the Andi product to help people live more independently for longer by identifying small changes in behavioural patterns on a daily basis and allow proactive interventions prior to an emergency situation occurring.
So one example that we saw in one of our extra care facilities is where one of our residents who has dementia, there was something that staff had noticed in terms of their patterns of behaviour. Because we have the 2IC Care kit in place, we also noticed that there have been much more frequent visits to the toilet over about the previous 48 hours. We passed that information to the GP, and that additional information helped the GP to come to a slightly different conclusion, and it actually turned out that the individual had a beginning of a kidney infection. So he was immediately able to prescribe some antibiotics that enable the person to remain at home, cared for by family members who visit the person frequently, without all the disruption going to hospital.
The daughter had approached the GP and it was put down as a progression of her illness, when in fact it was a UTI. We obviously haven't got access to anything like that with any other service user, so it was a prevention of going into hospital.
Remote monitoring introduces this remote care for those patients that we wouldn't typically have. With this, we can set rules and alerts in the system, and then we can intervene, so it's all about prevention. That is vital moving forward.
It was very easy to install. It was easy. Get it paired up. Doesn't take long to install, less than 10 minutes, and you can use different periphs. So if you did have a problem with one, you could switch it, which is good because there's systems out there. You can't change the periphs. The periph has to be the periph.
Relationships with the suppliers of this technology is absolutely critical. I think with 2IC Care it's very clear. They understand the world of care, and that just makes it so much easier to talk to them. There is that mutual understanding of where we're both seeking to get to as organisations.